bilateral. So if you see bilateral erythema, it might also talk about like itching and scaling, which could sound like psoriasis, but it's the bilateral, usually the lower extremities, and then the prevention for that is going to be compression stockings, movement, and leg elevation. There might be some topical glucocorticoids for that scaling, as well as antibiotics if it says anything about a secondary infection. And that's mupirocin, which we talked about with impetigo as well.
Okay, so pressure ulcers is also another topic. The biggest risk factors would be immobility. Also, diabetes is a thing I deal too with pressure ulcers as well, since they lose the peripheral sensation.
Yeah, the 4 stages. I think on the question or on the test, I remember one of the questions being about like there was bone exposure and it wanted you to get at what stage that was. So I think the biggest stage to know is that by 4 you have tendon or bone exposure.
I think it might have said like no bone exposure, so then it was stage 3.
Yeah.
So they might do a different stage.
So just know the differences in your stage.
Okay. So then drug eruption. So exanthems is going to be kind of like a maculopapular eruption. It's going to be type 4 hypersensitivity reaction. The biggest thing is just stop the drug if this does occur. And then a treatment would be topical corticosteroids. And then urticaria is going to be like the hives, welts, wheals. And you're going to use antihistamines for that. It's usually an allergic reaction.
Remember that the Gen 2 is less sedating.
Okay.
That was a big factor too.
And then exfoliative dermatitis, also known as like the red skin, erythroderma, red skin. The most common cause is going to be drugs, and we just give supportive care, and then we want to prevent okay, and then alopecia was also a big topic. I think the question on the exam, it kind of sounded like alopecia because it was talking about hair loss, but then it was said
She had like
scarring.
scabs on like the crown of her head.
Yeah, I think the biggest thing was like the scarring, so I think the answer was clobetasol.
Yeah.
But I feel like it kind of maybe threw people off because it sounded like hair loss, and I think minoxidil was also an option as well. So, androgenic alopecia is going to be progressive hair loss with thinning, and that's we are going to treat with topical minoxidil. But then if it's talks about any scarring, that's going to be clobetasol. And then just remember that scarring is also called cicatricial, and then non-cicatricial for non-scarring. And then alopecia areata, this is the autoimmune disorder where hair is in the anagen phase prematurely. And then it's going to be like exclamation point hairs, they say that.
I don't think they ever use that phrase though, but if it's like a patch like that upper left hand.
I think they might have that picture. I think I remember seeing that picture with the patch.
Yeah. Okay. Animal bites. So this one was a big one. I know people were kind of confused based on some of our different lectures. If it's a dog bite wound or any animal bite, we don't close it because of the risk for increased infection by closing it. And then the most contaminated bite is a human bite. I think that was a big topic that Wagner went over with us. And then the treatment is usually amoxicillin for prophylaxis if someone was bit by an animal. And then if there's a penicillin allergy, then you can use Doxy or Sarpinone. But yeah, don't close a dog bite wound. I think the exception is if it's on the face or scalp, but I don't think we covered that too much. So.
Alright, erythema nodosum. This is typically going to be bilateral, and it's going to kind of be described as like tender nodules. You can have a prodrome fever and also fatigue with it. A big risk factor is if they're taking oral contraceptives. I don't remember I think that was what was the question that we had. And then I think the answer was NSAIDs, like for that question.
That was ibuprofen, I think. Something like that.
Yeah, that's right. But yeah, typically it'll be like women 25 to 40, they can be pregnant, but it's usually self-limiting, that just resolves within weeks on some.
Molluscum contagiosum, this was the one that Neil had told us abdomen or buttocks, but it's common in children. So if there's a question where it's common or something about a child with bumps on them, then maybe think of this one. And then the treatment is not liquid nitrogen because it's not warts. So don't get those two confused when you're reading the question.
Okay, so for farm, we kind of split it up just in like our big groups that Foster kind of puts them in, but it just kind of hitting like high yield points for that. But for acne, the drug that's contraindicated in pregnancy is adapalene. I think that was like a question on our exam. Do not use benzoyl peroxide with dapsone because of the yellowing of the skin. Minocycline has the lowest risk of developing resistance. And then retinoids, I think there was a question where it was like asking what's the most important, and it was the consistent use for retinoids. Those are also contraindicated in pregnancy. And then rosacea, first line is metronidazole. We can also use this treatment in perioral dermatitis. And then for pigmentation, just the two that we have. For hyperpigmentation is hydroquinone, and then hypopigmentation is methoxylene. I feel like I kind of remembered it as like hyper was with the hydro, so just remember that different. And then yeah, I just remember hypo was oh yeah, I think this was a question on the exam where it was kind of talking about someone with like scaling something, and I think the answer was emollients for that. For topical corticosteroids, they calm inflammation, so that would exacerbate perioral dermatitis. And then also topical immunomodulators were talked about. But this is the list of topical corticosteroids that Foster had, and I feel like knowing these are important because I feel like we went into it just thinking we just needed to know topical corticosteroids for the treatment, but then she would have like actual drugs. And then dupilumab is the most prescribed for atopic dermatitis, which we just had.
Okay, morphology, we put these, I would take a look at these and just remind yourself if you don't remember them. I know we've been kind of going through some of them through the semester, but there was definitely questions like where you had to know the difference, especially like vesicles and things like that. So take some time to go back over these and put some pictures just so we can see them.
And then the difference between paronychia and felon, there definitely was a question about this, just describing something on the finger. So just remember that if it's something on the outside, how they like to describe it here. Yeah, nail folds usually is paronychia. But yeah, we just do warm compress for that. And then for felon, it's usually going to say something about like the finger pad or something usually. And then we're going to do a first gen cephalosporin. These are both caused by steroids.
That's this question, so. Okay, and then we put some of the viral things together just to remind you guys. So pityriasis, rosea, that was like the Christmas tree. A lot of the words like that they used like to teach us, they didn't use on the test. So just being familiar with more of like what the symptoms were of these things is important. There was a picture of a hairy patch. So remember that that's the first like lesion that appears for pityriasis, and then that was herpes 6 and 7. And then herpes simplex virus, these ones are more described as root vesicles, which I know we've seen a couple times now too. But the first outbreak is the worst outbreak, so it's going to be a longer treatment for 5 to 10 days. And
the answer was like IgA. I forget exactly what it was.
Yeah, so IgA is associated with dermatitis or pseudomonas. Okay, this was the early staging for hidradenitis suppurativa. So it's gonna usually describe like tunneling, and then usually in like folds like the axillary area. And then let's see, so then the early staging, I would just be familiar with the different stages without a tunnel versus with.
And then perioral dermatitis, the most common cause is topical corticosteroids, and then to treat, we're also just going to use topical metronidazole. I think this time of the question was asking what exacerbates it, and I think the answer was the topical corticosteroids.
Lichen planus, the treatment for this again is corticosteroids. This was the 4 Ps. So if it starts to describe something that's pruritic, purple, polygonal, papules, and then there might be an oral mucosa, like comorbidity with it as well. So it affects kind of a lot of different things. The Wickham striae was the top finding.
Alright, and really quick, just melasma versus vitiligo. Melasma is going to be like the red or darkened on the face, usually for pregnancy. We're going to treat with hydroquinone, or acetic acid. And then vitiligo is an autoimmune when the melanocytes are being destroyed. So we're going to do photoprotection and then topical corticosteroids.
Cancer, so Kaposi sarcoma is an HIV-related disease. I would associate those together. Basal cell carcinoma, remember that is above the neck, because I think that was only 7 on the slides. So above the neck, basal cell carcinoma. If it's on the nose or something, that's the first thing I would think about. Squamous cell carcinoma is preceded by actinic keratosis, and it's described as kind of like that sandpaper feeling on the skin. And then malignant melanoma is the biggest prognostic factor for that one is the tumor thickness. And then I would go back and there's a picture of like the staging of like the risk factors, and it's like the skin colors, and so that might be a good image to look back on. But it's the leading cause of death from skin disease, and then remember our metastasis, which I know we talked about in this block as well. So LLBE, liver, lungs, bone, and brain. And then we talked about ABCDE, so asymmetry, irregular borders, color variation, diameter, and then evolution of it.
And then we just want to put some like quick pictures, just with like the different disorders that we talked about, just to kind of give you guys another visual. Yeah, like dermatofibroma is the dimple down. The canthosis nigricans is the insulin resistance. Seborrheic keratosis is the step on, which I don't think they use that. I think they said like waxy or bubbly or something. Skin tags. So just kind of give you guys a visual stuff.
Chronic actinic dermatitis was the one where it's the demarcations in the lines of clothing. And so it might be like a vignette about like a man who's been working outside and things like that.
And then this was I just put this in really quick because they did ask one of them. Those were the C ones on the exam, so they might just choose like a different word. I just remember her saying like, you guys need to know these definitions. So I'm assuming I'll probably use one on the exam. Just for you.
Okay, and then this was for Dr. Kelly when we asked her about any advice for dermatology. She said, if it's wet, dry it. If it's dry, wet it. If they're on steroids, stop them. And if they're not, start them. When in doubt, biopsy. I feel like that was true. And this is my dog Bella.
She's dry and wet.
Alright. Do you want to do you need a quick thing? So we'll pull that up for you guys real fast and do some quick questions.
That was great. That was solid.
Thank you. You worked hard on it.
That was solid.
46-year-old man presents with a large raised fluid-filled lesion measuring 2.5 centimeters on his left forearm that developed after doing yard work over the weekend. The lesion is tense and filled with clear serous fluid. What is the following best describe this type of lesion? Sorry. I don't know.
It was Ebola.
Yeah. Sorry. I didn't do that.
Ebola.
My bad.
Okay, a 6-year-old child is brought to the clinic for a rash around the mouth and nose. The parent reports New painful rash after starting amoxicillin. Key findings are pictured and extend to the upper extremities. What's the diagnosis? Don't be tricked. Alright, and I do a body test to the clinic for evaluation of distressing white patches on her hands and face. She denies itching or pain. Physical exam is significant for multiple sharply demarcated macules and patches of depigmentation, which of the following drug classes is the most appropriate first line management. So that was vitiligo, white patches, clearing of the melanocytes. Alright, which of the following diagnoses is most consistent with the pictured lesion? So remember the A, B, C, D, E for this one, so it had the indistinct borders, the varying colors. And then I know like it'll sometimes talk about someone who's got like a lot of freckles, but then they have one that was like atypical, that was another example. Yeah, that would be definitely those two. Alright.
A 10-year-old boy is brought to the clinic for worsening rash. His mother reports that there are several red circular areas that have grown in size. Family recently got a new puppy. Physical examination is significant for stately annular lesions with sharply marginated plaques and central bearing on arms and legs. Which of the following is the most likely diagnosis?
So this one was ringworm. Usually there'll be like an animal involved with it, the new puppies. But remember the description of it, like those angular lesions. Which of the following is considered first line management for rosacea? Yeah, so metronidazole for rosacea, not corticosteroids.
Sixteen-year-old girl comes to the clinic with skin concerns. She reports last 6 months she's experienced worsening melts on her face. Physical exam is positive for erythematous, muscular papules along the cheeks and forehead with the following most likely diagnosis.
I feel like I'm Alrighty, a 22-year-old woman came to the clinic for pain and swelling around her fingernail on her thumb after getting manicured 3 days ago. Upon physical exam, there is a mild erythema and swelling noted at the proximal nail fold. Which of the following is the most appropriate initial management? Good. So yeah, this one is warm compress. If it were the felon, which is on the finger pad and fluctuant, painful, then that would be oral antibiotics. But for this one, the initial treatment is just a warm compress.
Susceptible